Yes, welcome once again to Dr. ABC Show. My name is Dr. ABC. I'm a physiologist, and today we also want to talk about the things that goes on in the consulting room. It's very important we know some of these things when we are going to the clinic, because sometimes people say that, well, I went to the clinic, the consulting room, and I spent about 5 minutes. We want to see whether there is an average time that is expected of a patient, because you see, when you were going there, you saw a lot of patients were also waiting. Do you have to spend all the time? We have a doctor here who will explain it to us. Sometimes too, we all have the challenge that whilst I was talking to the doctor, he was writing, and he didn't even look at my face. Should we be concerned, or it's normal? We have the doctor to explain to us today. Other things are also like you are talking to him and he's on his phone. Whatever he's doing on his phone, well, we can't tell. We have a doctor here who will explain some of these things and many more things that goes on in the consulting room, so that we don't get offended when some of those things are being done in our favor. Because I know that maybe the doctor is checking something on net on in your favor, maybe something that will benefit you, except that he might have not told you what he's doing on your behalf. To help us answer all these, we have a very experienced and well-read doctor here, in the person of Dr. Antwi-Boasiako, who is the one in charge, the medical doctor in charge of the medical school clinic. Very experienced man to explain some of the things in the consulting room to some of us, so that when we are going to the hospital, we will not feel offended. So, Dr. Antwi-Boasiako, you are most welcome to Dr. ABC Show.
Thank you once more again. So, in the previous episodes, we actually started from when you come to the records.
Yes.
And then you go to the nurses.
Nurses, yeah. We take the vitals.
The vitals, that is your BP,
yes.
temperature, we say all. And some of them are related to family history and all of those things. And then now they come to we jump to the lab, the OPD, where your age determine, and then your sex, how to interpret the lab, how the pharmacists have to give the medications to you depending on your age, and explain all those things. So now we are coming to the consulting room. I like to use the word that you see health practitioners. The doctor is only one of the components of the health system.
Okay.
But that's where your history is taken, or your story is heard.
Okay.
That's why you are examined, and that's why the test to diagnose you or diagnosis is finally done. And that's why medication is given or taken. Yeah. So yes, it's two ways. Some, by the time they talk finish, they say they are gone. Some, you take your time, they'll be mumbling and be grumbling.
Yeah.
So, outside.
Yeah. So I wanted to start with the time. So I enter. Is it an average time universally? Because this complaint is not only in Ghana, all over the world. The complaint is the same, that I didn't keep long. So it's like there's an average time.
They said 12, 15 something minutes. But as I said earlier on, if you come to me as the first time, I'll take more than that to get all this history and examine. I'll take more than that. But if you came to me yesterday and you come to me today to look at your lab reports, it may take less than 2 minutes, 3 minutes, or 5 minutes. But the problem we have in these parts is that our clinics are overloaded.
Okay.
Ideally, in some places, you don't see more than maximum. You may not see 20 patients in a day. They're 8 hours, so you can spend time with them. It also varies at the primary level. The primary level, the people are plenty, and sometimes.
So you say the primary level.
Primary level, that's the health center, the district hospital.
Okay.
And sometimes, I'm not defending the doctors. Sometimes you have an idea of the kind of things that the people bring.
Okay.
So once they start, after a while, you know what it is.
Yeah, but psychologically,
I agree with that. I'm not explaining that. Yes. So psychologically, people want to quick to hear, slow to speak.
Yes.
So you must listen to people. That's why these things become very important. That by virtue of that, I have to show. Sometimes what we will do is that greet the person from the gate. Welcome. Good morning. Are you patient? So and so. You've interacted with the person. Oh, it's your name, so and so. You started in the person.
That is trying to confirm that
he's the person.
He's the right person.
So you've engaged the person, and that's this. What can I do for you? That's what I usually ask. Or what are you here for?
Okay.
So at least that one will interact before he starts to talk.
Yeah. So there's a reason why somebody may not spend so much in the consulting room.
Yes.
And there's a reason why somebody may spend so much. It is not because you love one and you hate one.
No.
That's what I want us to address. It is not because one is important as against the other. But from what you are saying, the volume of information.
We also have now more people seeking more knowledge. And because we don't read, that's the way I put it. We don't seek information for ourselves. Sometimes patients will come and they'll be asking a lot of questions. We are not having that also. And sometimes it's not for you to see how you can ask, is that person out? Because someone will be asking doctor. Or they accumulate certain things, so they don't think coming to hospital is important. They think their work is more important. So they come now, they want to get all the answers, all the questions. And that is also one way of doing the issue. And then we also don't have counselors and psychologists. Even the pharmacists, you have 1 or 2 pharmacists. No, it should be that somebody should do take the medicine and explain things. Somebody is not taking his medications. I owe it to the person to explain to the person why it is wrong not to take, why he's taking this, why even if he's believed by faith, he should be taking the medicine and be checking the blood pressure until it is done. Or if he's taking herbal medicine, he should also be taking or come and be checking the blood pressure so that the herbal might not get stroke one day. So all those issues are coming in now.
Yeah. So if I am in the queue and I'm just observing those entering and coming out, A came out very early. B took a lot of time. B, they love him, power. He's a special person. C didn't come. So that should not be my mind. I should know that there are good reasons why some are spending so much time there, and not because of partiality.
No. It is. We also owe it to them. So sometimes one of the things I do is that I go to the nurses, go and explain to the nurses this is happening. So I said I'm taking time on this particular patient. I will not say exactly what I'm doing. Then I'll explain. Because sometimes you have to examine, wash your hand and do things.
Yeah, but that's the nurse, but not the patient.
No, I tell the nurse to go and explain to the patient outside.
Oh, okay.
When there's a delay.
Okay.
It's very important to know how to manage. That's what we have in this program.
Okay.
We also owe it to the patient to manage their expectations.
Okay.
By recognizing them. So if there's a delay in a particular patient, we owe it to the patient to send the nurse or somebody, or sometimes I peep outside and say, I am hot. Occasionally, I go and deal with a patient who is on detention or who needs a special procedure. So if you are going, you have to go and explain to the patient, particularly if you are alone, that something is happening, you have gone to attend it. So we also owe it to know how to manage the expectations of the people by communication. But unfortunately, our training also doesn't train us on the soft areas of life. We are trained on the hardcore diagnosis, medication, and treatment. But most patients don't judge us on that. They don't know. So even if I give you water and it's very painful, he's very happy. It's only my colleagues that can judge me on that. But the patient judges me on communication, cultural understanding, how I relate to you. That's why the traditional people seem to be better than us. And I always ask the medical students, quite crazy that fake doctors are better than us. And they say, why should fake doctors? I say, oh, they catch people, fake doctors. They say, know why? When the patients come, they go and meet the person at the gate. They get the person sit down. They ask certain questions. So the person says, oh, doctor, why you power? Oh, this. Then there's a certain warning also. These days, a lot of elderly people come. Because they are lonely, some of them come to the hospital just to come and talk. That's to come and confess. We have to know those things like that. Oh yes, I explain that a lot. When they come, if we are 2, then I take the younger ones, then I close the door. And sometimes I spend 1 hour with one elderly patient. Because he has come. He or she has come to the hospital. Then I send the people to the younger one. So our training also of all health personnel will also need to change. That we should be trained not only in the tertiary setting, but our training should also take us to the community.
Okay.
And our training also have to involve cultural understanding of culture, more of the psychology of the people, more of the social setting, social environment of the people. Then we can know how to relate to them.
Yeah.
Green Hill Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hill Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055 2505 108 or 030 3974 818.
Okay, so if I get you clearly, what it means is that if I am part of the queue outside and I see a particular patient who is taking more time, I shouldn't be angry. There's a legitimate reason why that person is spending so much time. It is not because you hate all of us, but you love that one only. Okay.
In addition to, it's what we call triaging.
Okay.
Sometimes the nurses will come outside and go and peep and see the person who is uncomfortable. And sometimes we pick that person out and explain to the person.
That is tragic.
Yes, tragic. So we do that when they go to the nurses. You look at the BP, the pulse, and this, and decide. And sometimes we break the queue.
And so
for somebody.
And
now you have to explain to the patient why you have to break the queue.
Okay.
For those people to come. So that's what I'm saying, that we need a lot more of this thing. That's why these days a lot of hospitals are now doing teaching their staff how to engage, how to talk, training. I think we are even going to have one recently.
So I think that's a point of great concern.
Yeah.
That in the queue, if you see the nurse coming to pick somebody from the queue to go and see the doctor, it is not because that person is so special, but it is because there is a reason why that person must see the doctor immediately. If not, you may not be able to finish the journey with that person. The person may collapse or die or whatever it is. So I think that that's why we are giving this education. That sometimes you see everybody chuckling, and even the one who is sick going in even feel bad. So, but when this education,
it's a serious issue.
Yeah, when this education goes out, it is not because of partiality, but sometimes there's a clinical reason why that must be done. So thank you very much for the explanation that you have given us. I think one area we also look at is when a patient is talking, the doctor is writing. I mean, the only time you look at your face is when he has finished and he's giving it to you. Is there any?
I can't defend that it's also an issue.
But should we be bothered?
Yes, the patient is bothered. We, the health personnel, must also be bothered, because as I said earlier on, the patient don't judge us. You may be a very good doctor, and just sometimes we are trained to look at the patient. So by the time the patient walks in, sometimes you can even make a diagnosis, or by the time the patient makes one or two things. From experience, you know, but the more experienced you are. But you may not need to do certain tests. I have learned that myself the hard way. That certain people you need to do the test, not because the test is relevant, but because if you don't do that for that patient, you are not managing the whole patient. You are not managing the emotion of the patient. You are not managing the feeling of the patient, because you are treating the whole person. So sometimes this is why sometimes we ask for a certain test, knowing that it will be negative. But it's the negativity of the test that will help the patient to be well. So after, your test has come negative, therefore I will do this. So it's come to more of the modern training, that it should be balanced. It should balance. That's why I always carry money with me. I always carry money in my consulting room, money with me all the time. That is always two sides of a coin. If you have only one side, it's not legal tender. It's not legal. If you have the other side, it may not be tender. So you must always have the two sides. One side has a coat of arms. That gives legality. The other side is what have the value and the thing. So it's very important to, in our training, we need to up how we engage on these aspects, that the patients are not less interested in the diagnosis. They just want to be well, but actually they are more concerned about how we talk to them. talking about the one about people on mobile phone.
Yes, that's the next place I'm going to.
Mobile phone.
Yes.
It's a challenge. Many people actually go on the mobile phone now to help. We are one profession where we actually admit that we don't know it all. Most people don't know.
Yeah.
We don't know it all. So you have books sometimes in the front of the patients. We open books, and then we check, because you have to check. You can't keep everything in your mind. For example, the treatment, the medication, what to give to this age, you have to do calculations. You have to do things.
Yes. So if we are before the doctor and he is on his mobile phone, it may not necessarily mean he's doing WhatsApp or whatever it is, but it may be for your good.
But we owe it to the patient for him to know.
Okay.
So what some people do, I know, is that they tell the patient, I'm checking something. And when they check, for me, I use the tabletop. So when somebody comes and say I have Bitamaf, and I'm expecting that I should give anti-malaria, and I don't want to give, I just go on the net, Bitamaf, and I have 13 courses of Bitamaf, and they say come and read for you, man. Blocked nose can cause Bitamaf, dehydration can cause Bitamaf, pregnancy can cause Bitamaf. So if I don't treat you for malaria, this is what you have. Please it yourself. They read, and then they are comfortable. Okay. So it's for us again to manage. That's what I'm talking about, the soft skill of our training. We need to upgrade on the soft skill of our training. Yes, this is what I'm doing. And then if you find I read it for the patients or understand this is what I'm doing, so that he knows that that time is for him. Okay. Not for me.
It is not for
the good of the person. Or sometimes, yes, I'm on HIS now. The patient is gone, and then I'm now entering certain information and data. When the patients come, I tell them, please, I'm trying to finish what I did before I want to enter. Then that is. So we need to engage.
So the communication is very, very important in that case.
Yes.
But then the fact that the doctor is on the mobile phone does not mean he is neglecting you. It does not mean he is doing WhatsApp to communicate. No. Even if he's communicating, it may be for your own good or whatever it is. So I think that we should know how to manage this.
Can I say something?
Yes,
also?
okay.
Let's be more assertive as Ghanaians.
Okay.
Assertive means let's probe further, let's challenge, but challenge in a certain way. Because I say most of the road accidents you have, I give it as an example, is because a typical Ghanaian will not challenge the driver when he's driving recklessly. The person who challenges the driver is the person who is doing wrong until accident happens. No, we must be assertive. We must learn a little bit of assertiveness from the Nigerian. People may say they carry it far, but we need to learn a certain bit of assertiveness. So, sir, we are on the mobile phone, is it? Or the listen, are you checking something for me? If you use that wisdom, what do you think? You tell the person, please, if you're not checking for you, sir, please, sir, can we continue? Can I say something? There are ways of handling, ways of hand. That's what I'm saying. Then you are in control. You are directing the thing. So these are the reasons why, we need to have these practical aspects. Let's come to the confident. Because sometimes we come to the confident ignorant. We don't read. So most people come and say they have this. I say, what did you read? I'm in the medical school. I ask the student, what did you read about this? Many of them, they have not read. I said, you should be able to read. If you care about your body, and you have headache, which lasted for 3 or 4 days, you should be able to find out. Headache, 4 days. So
the other question we ask is that sometimes you go to a hospital with maybe headache, and upon examination, the doctor may like to examine you further to see, and sometimes people ask questions. Why is it that I went with a headache and the doctor examining this part of my body? If you can throw more light on it.
Very critical. It's a critical issue. The headache may be the end point of what is happening to you. So we call that the presenting complaint. So your presenting complaint is headache. But then the next is, what's the history of the presenting complaint? So we go back and find out that what happened. Although you came with headache, 2 days, 3 days ago, you had a blackout. Or it's not seeing well in one eye. Or something's happening. Then I take the age. I take the work he's doing. Then, is he having something, or something fell on his head before? We have to ask all those things. So therefore, he may have a bleeding inside. Or is he hypertensive, diabetic? or is maybe she's a woman, has she been bleeding abnormally? If she says she's bleeding abnormally when she's in the menopause, then I have to find out whether it's a cancer of the cervix that has spread to the brain. So she may come with headache, but I will examine the downstairs of the woman.
Oh, okay.
Because there may be a link to the, or I may examine the abdomen and find out that the liver is what? Enlarged. That's causing has spread to the brain. That's causing cancer. So the most important thing is, has the doctor asked a lot of questions, and then we also need to be explaining to the people as we are asking the question, as we are examining. Then, madam, I think this, I would like to examine this part. It looks like, what is it that we are looking for? It's likely this. I don't just want to do a scan, but I want to make sure that if I go, the reason why I must send for the scan, because in certain parts of the world, they are no longer touching.
Okay.
They're using robots and people, and they also realize that they are missing out on a lot of things. But we are still touching.
They are using robots to examine patients.
I know, sometimes by the time you go, what they do is that they run a battery of tests.
Okay.
And then battery of this, and use that as a basis of diagnosis. They're also finding out that they are missing out on a lot of things. That's why many of the students who come here on elective, they are very happy when they come callable, because they still have hands-on experience to touch people and feel things. So either way, it is yeah. So you may be blind, you may not be seeing well, but maybe that's what happened. There's something wrong with the kidney something is affecting them, and that's why I tell people that that's why we go to school for law. If it's every disease is malaria, if every disease is typhoid, then I've wasted all the number of years I've been in school. Some first 6 years, then after that they do postgraduate for another 6-12 years. So we'll just come. But if it's that, then we don't have to do the number of years we did. If it's that simple, if it's not complicated, we are not saying that we are better off, but it is that understanding that will make people to know that. And then sometimes people are also not patient as a process. Or go and do this test, come back. Why are they asking me to do this test? But sometimes the tests have to go process. You do this one, and then this one will give you this. But what you are saying also applies to tests. You do this test, the results will come before you can move on to do the next test. And the next test, somebody comes with hepatitis B. I'll give you as an example. Positive. Many of them will be positive. They don't need any treatment, about 98% of them. But there are a few.
About 98% of them
yes.
need treatment.
Yes. They need a few. Then you do the profile. You do the profile finish, then you do scan of the abdomen, the liver. You do certain things. You do viral load. You do alpha-fetoprotein. You do so many things before they can be advised that you should be giving medication. But there are people out there, once you have a person, take this. No. And a lot of people end up at the clinic, at the this center, the kidney dialysis center, because they are taking all kinds of help. They are taking all kinds of medications which are damaging the kidney. And we are seeing many young people who are coming because we don't understand process and systems, and we don't understand perseverance. And then because process must go before perseverance, then you get the best result. So that's why we need to. And then we didn't talk about the educational level is also important. When you are talking of the things, the factors you must know. Sometimes you have to come with somebody if you cannot explain the thing. And we need to know the culture, talking because when I went to a certain part of the country, the moment will come and say there's a stone in my lower abdomen. Why? Then I asked the nurse. Why did they buy a stone in my lower abdomen? Before he told me that culturally, those people have what we call uterine prolapse. The uterus is coming out. So in their understanding, that's how they express it, that something's pushing it down. So it's a stone. And those people, they leak urine. So culturally, they are smelling. They are ostracized. So they can't come to the clinic and say that. So it was the nurse in that community who they helped me to understand that this is a unique thing with those people. And therefore, when they come, they say it. Then I know how to take them aside, how to examine them, how to deal with them. So it's on both sides. I'm saying, so what we are saying is not just for the patient, but for the doctors as well. That when we are doing those things, I want to move from the head down there. I must explain to the woman. If you're not comfortable at that time, I can say, okay, if it's not life and death, I can say, come back tomorrow.
Okay.
To do it. Or do you want another opinion? We must also have second opinion. Please, let somebody else hold. If you're not comfortable.
Green Hills Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hills Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055-2505-108 or 030-3974-818.
That's very, very great. So what you also want to educate us on is that sometimes we go to the clinic and you are not given any test to do and run, and people don't feel comfortable. They feel that they have not been seen well because everybody goes the right and go and do X-ray, go and do this. Me, I didn't get any test to go and do.
It's not an easy thing to handle because we have the reverse of that. Why many people come to the hospital, they don't need any medication, but you can't send them away without medication. Many people I see now, more people have what we call psychological problems that don't need any medication. But if you tell them they don't have it, so we are forced to do. If you say my heart is beating fast, your heart will beat fast because what happened? You stole in the office and somebody there say, oh, somebody stole in the office, and then they say they are coming to do auditing. The heart will beat fast. So once the person comes, that's why the psychosocial history. We didn't talk about that. It's extremely important. Psychosocial history is extremely important.
Okay.
To the extent that we now have a clinical psychologist attached to our hospital. Colombo has now employed so many clinical psychologists.
So it is not every ailment or sickness that demands laboratory tests?
No, because, and it also depends on the experience of the person. As the years go by, you can smell certain things. I know. Then you know that you don't need any lab. So we use the hand, the ear, the eye, okay, and the smell. It is when we are not sure or we want to confirm that we go to lab. Labs are.
How do you use the smell? How do you use the smell?
Oh, when somebody has a kidney failure, we can smell. When they have certain disease, you can smell. Okay. You can use the smell. You can use the smell to know that this person has a certain diabetic something. You can smell certain.
Oh, okay.
You can use the so we use the nose, of course we use the mouth to speak. So we use the five senses and so once you do that, it's not necessary. But what is happening now is that many people now don't believe in the primary lower level. In the lower level, the things that come to the lower level, normally 70% of them can be treated with that lab.
If you say lower level,
health center to district hospital,
okay,
the clinics,
okay,
where you don't have specialists.
Okay.
The things that must be handled at that level, 70% should be done by asking questions, seeing and touching. Then the remaining 30%. Okay. But at the tertiary level, where most of the cases are complicated,
so tertiary
that's the Kolebo, Okofanonche,
okay,
the specialist private hospitals.
Okay.
The regional hospitals are in between. And those two. Then there, 70% of the things are actually done by diagnosis. Because the medications they have failed at the lower level, are you getting me? The history hasn't helped, the examination. So when you go at that level, sometimes even before the doctors examine you, they ask for certain test standard. Any person who comes, let's do this test, let's do this test, this, because we need you to know. And then you have to go MRI, you have to do CT scan. So at those levels, it's not also because sometimes the doctors don't know what the person doesn't have. It is to help them to know what to do.
Okay.
What type of surgery to do.
So that explains why sometimes a doctor will request for test before even seeing you.
Yes,
because sometimes we are worried that he has not even seen me, he's requesting for test.
Yeah, the tertiary, because by the time you come there, you are setting this thing, we know that there is this issue.
Okay.
So it depends. So at the lower level, but what is also happening is that we are training our people, and this is very controversial to my colleagues. We are training primary level people at the tertiary level. Okay. At the tertiary level.
Okay.
So we need to get them to be move more into the district also to get the lower level thing.
So sometimes people also get disturbed when they have not been examined. They come to the clinic and they think that they should be touched.
That one, every patient must be touched. So you can do this. You've touched the patient. You look here. You've touched the patient. Because we are touch people. Bring out your tongue.
Okay.
You start the patient. But the nurses do it. They do the blood pressure. They count. So that one I agree. Every patient who comes
must be touched.
Yes, for one way or the other. So what usually is, I do this. I look at the person for a pulse. I touch the person. Or if it's this thing here, I check. It's vomited. Is it okay? It's a cultural thing.
Okay.
It's our environmental thing.
Okay.
So you have to understand
so the
that one
advice
also.
is to your colleagues that
Yes.
they should try to touch.
Yes. And then you should have eye contact. That's why I think as the person coming, oh, good morning, how are you? Are you Mr. So? You've communicated. Okay. You've touched the person actually, mentally.
Okay.
Then physically you also touched.
Okay.
Or psychologically you have touched the person. So we have to move to that level.
Okay, so very too soon our time has come to an end when the discussion is getting very interesting. But today we have learned a lot. Why somebody will go to the clinic with a headache and they end up examining all parts of the body. Dr. Antwi-Boasiako has been able to explain to us what to expect and what goes on and why certain things are done. We are so grateful. And I know that you have also learned a lot today. Don't let it end there. You also have to educate other people and on what they should expect when they come to the clinic. Dr. Antwi-Boasiako, we are so grateful to you for coming on this show and coming to explain things to us into details. I think we'll meet on the next episode. Viewers, thank you so much for watching this, and I hope that you will stay healthy and you stay well. Prevent coronavirus by washing your hands regularly and sanitizing your hands. Stay healthy till we meet in the next episode.